Esmeralda is going to talk about the flash drive. The flash drive contains what we've been calling so far the CPIC Toolkit. So get to see what it is. And it's the first page on your handout is a table of contents for the flash drive.
Okay, so everybody, does everybody have their flash drive? Everybody, that's kind of your surprise little present is the flash drive.
Yes. So in the flash drive, there's a variety of resources. And so when you open up, you'll see this CPIC resources for agencies. And we have a folder with articles, and basically all of these articles are listed on the back of your one page here. And they are articles that that talk about the different projects that happened before CPIC, so Partners in Care, and there's very informational articles on collaborative care and just some community updates that explain the study and the history behind the study. So a lot of what Dr. Wells and Elizabeth spoke this morning, and we also have the book that you have in your handouts. We also have it as a PDF file. So if you'd like to share it with someone at your agency, you're free to copy that or pass it along. So we have the book there, and there's also some depression slides. And these are also very helpful, I guess, if you're talking to a friend or a client and you want to just cover some of the basic symptoms of depression and some of the different options for treatment. We also have in this flash drive a care manager toolkit, and we have a guide for the care managers and a variety of forms that can be used when you're doing your sessions with your clients. We have a CBT therapist toolkit, and this is where we have the CBT manuals, which cover the BRIGHT program, and we have these available in English and in Spanish. And these therapies can be done in an individual session or in a group session. And in the open session, members are welcome to join at any module of the program. So there's 3 modules: the thoughts, the activities, and the personal interactions. So if you're having a group, people are welcome to join at any module. I'm sorry? Oh, sure. So,
okay, so
the group, let's do the group at open group leader.
the open group.
Uh-huh.
Member, not leader.
Either one is fine. Open group.
Okay, it's the open group leader.
Right. So you'll see that that this is an introduction for the leader. So it explains to you how to use the manual, and then you actually have a leader guide with some tip boxes for each session guiding you. And then there's the members workbook, which you can give copies to your all of the other members of your group. And so, like I said, the open session, anybody can join. The closed session is when you want to have a focused group for the full 12 weeks of treatment. And so you would go through the entire 12 weeks without having other members join, intermittently. And so those are available, like I said, in English and Spanish. They're very, very wonderful therapy manuals. Developed by Dr. Jeannie Miranda, or catered by her. And we also have some forms for therapists in this toolkit. And the can you go back one, Mariana? Sure. The contents of the toolkit, that document explains to you or shows you all of the various forms that are in this packet. So those are all the BRIGHT manuals, and then we have all of the forms listed here. So getting to know you, post-evaluation, just great resources here. And we also have a clinician toolkit. So this would be for, MDs, nurses, nurse practitioner, anybody in primary care, but it can also be used by case managers and outreach workers. It's a great resource. It covers, some of the basics on assessment and evaluation, right, of depression. So
it's on a medical model, so we understand that not every it was written It was written for primary care providers. It follows the medical model, so we understand that it's not applicable to every provider. However, the assessment algorithms are very helpful, and I think it's also helpful for case managers because oftentimes their clients are not seeing the primary care providers often, but in the case managers are helping, really the provider helping the client is stay in treatment and keep up with the treatment plan. So it's helpful to understand what kind of treatment the client is undergoing, what their medication is, what are the possible side effects of that medication, how soon is it advisable that the client comes back and talks to a primary care provider about changing medication. And all of this is covered in this clinician toolkit.
And there's additional materials for administrators. Jim, do you want to just briefly cover some? We have the levels of engagement piece that you wrote, and we have the training agendas and training materials for teams, which Elizabeth and Jim will do an activity and exercise with us in a little bit. So we have materials for administrators, and then lastly we have we have some patient education brochures, and those were in your bags when you got here, the Spanish and English brochures. You can print those out, hand them to clients. They're informational. They cover the symptoms of depression, what are the different treatment options, there's hope, there's help, there's treatment available. And so those are there for your use. And we lastly have, which one was the last document? The user guide for partners in care. So that one, it covers the previous study, which was the parent grant of the Community Partners in Care study, and it covers a little bit more about collaborative care, and it has.
Well, this is the activity we're going to do today, so we don't need to spend too much time.
Is that the user guide? Okay, great. So it's very comprehensive toolkit, and if your agency needs a specific document, if for example the CBT manuals, we might be able to make some extra copies available in print, I think, right? So